Greetings everyone, and welcome to Dr. Nguyen's YouTube channel, your trusted source for health and wellness information. We're here to share knowledge, to empower you to take control of your health, and to navigate the vast world of medical information. Our focus today is on a common yet serious health concern, pneumonia. We'll be exploring its causes, symptoms, diagnoses, treatments, and even non-medical strategies to manage it. Today we delve into the topic of pneumonia, bearing in mind its potential severity and how it impacts lives globally. Pneumonia, a common lung infection, is a medical condition that should never be overlooked. This formidable illness strikes when our lungs become inflamed, often due to a bacterial, viral, or fungal infection. The air sacs, or alveoli, fill with fluid or pus, making it difficult to breathe. It's not just the discomfort that's concerning. The real danger lies in its potential to cause life-threatening complications, especially for those with compromised immune systems, the very young, and the elderly. Globally, pneumonia is a serious public health issue, claiming the lives of millions every year. But it's not all doom and gloom. Our understanding of pneumonia has come a long way. We know its causes, how it spreads, and most importantly, how to treat and prevent it. The more we learn and share about pneumonia, the better equipped we are to fight it. Understanding pneumonia is the first step towards successful prevention and management. Pneumonia can be caused by various factors, and its symptoms can often be mistaken for a common cold. Let's delve deeper into these causes and symptoms to gain a better understanding. Pneumonia is often triggered by an infection, which could be bacterial, viral, or fungal. The most common culprit is the bacterium Streptococcus pneumoniae, but other bacteria, viruses like the influenza virus, and certain types of fungi can also lead to pneumonia. It's not always due to infection, though. Sometimes pneumonia can result from accidentally inhaling substances into your lungs, like food, drink, or even stomach acid. Now let's talk about the symptoms. Pneumonia can present a wide variety of symptoms, and they can range from mild to severe. They often resemble those of a cold or flu, but they last much longer and can be more severe. The most common symptoms include a cough, which may produce phlegm, fever, chills, and difficulty breathing. Some people may also experience chest pain, especially when coughing or breathing deeply. Other symptoms can include fatigue, sweating, and a loss of appetite. In severe cases, individuals might experience higher fever, rapid heartbeat, and rapid breathing. The lips or fingernails may also turn blue from lack of oxygen. It's important to note that symptoms can vary greatly, depending on factors like the type and severity of the infection, the individual's age, and their overall health. Older adults and people with weakened immune systems might have fewer, milder symptoms. They might even experience changes in mental awareness. On the other hand, infants and young children might not show any signs of the infection, or they might vomit, have a fever and cough, appear restless or tired and without energy, or have difficulty breathing and eating. Recognizing these symptoms early can be critical in managing the progression of this disease. So, if you or a loved one are experiencing these symptoms, especially if they're severe or they persist, it's important to seek medical attention promptly. Remember, it's always better to be safe than sorry, and early diagnosis can significantly improve the chances of a successful recovery. Diagnosing and treating pneumonia promptly is key to a successful recovery. So how does a medical professional go about diagnosing this condition? Well, it often begins with a physical examination where the doctor listens to your lungs. A stethoscope helps them detect any crackling, bubbling, and rumbling sounds when you inhale, which might suggest pneumonia. To confirm the diagnosis, a chest X-ray is commonly used. This imaging test provides a clear picture of the lungs and can show whether pneumonia is affecting one or both lungs. At times, a CT scan might be used for a more detailed view. Blood tests are also conducted to check the white blood cell count, which typically increases with infections like pneumonia. In some cases, a sputum test might be performed to analyze the type of organism causing the pneumonia. Once diagnosed, the treatment for pneumonia depends largely on the type and severity of the pneumonia. Bacterial pneumonia is usually treated with antibiotics, while viral pneumonia often requires antiviral medication. For fungal pneumonia, antifungal medication is the go-to treatment. Hospitalization may be required for severe cases of pneumonia, especially for older adults, children, and those with underlying health conditions. Here, oxygen therapy may be provided to ensure the body gets the oxygen it needs, and intravenous fluids may be administered to prevent dehydration. But remember, medication is only part of the solution. rest and hydration are equally important in helping the body recover. It's crucial to drink plenty of fluids to loosen up the mucus in the lungs and get plenty of sleep to give your body a chance to heal. It's also worth noting that each person's recovery timeline can vary. Some people may recover in a week or two, while others may take several weeks to fully bounce back. The key is to follow the prescribed treatment plan and to not rush the recovery process. With the right treatment, most people can recover from pneumonia. It's all about timely diagnosis and following through with the appropriate treatment. While medical treatment is crucial, non-medical treatments also play a significant role in managing pneumonia. Let's talk about non-medical treatments first. Rest and hydration are key. Rest allows the body to direct its energy towards fighting off the infection, while staying hydrated helps thin out the mucus in your lungs, making it easier to cough up. Proper nutrition is also essential as it provides the body with the necessary fuel to battle the infection. Next, let's delve into potential complications if pneumonia is left untreated. The infection can spread to other parts of the body, leading to potentially life-threatening conditions. These may include respiratory failure, where the lungs can't get enough oxygen to the blood, sepsis, which is an infection spread throughout the body, and lung abscess, a pus-filled cavity in the lung. For older adults or people with chronic conditions, pneumonia can exacerbate these conditions or lead to long-term health problems. Now, on to prevention. Pneumonia prevention starts with living a healthy lifestyle. Regular exercise, a balanced diet, and adequate sleep can all support a robust immune system, which can fight off infections more effectively. Good hygiene practices, such as washing hands regularly and covering the mouth when coughing or sneezing, can prevent the spread of germs that cause pneumonia. Vaccines also play a critical role in prevention. There are vaccines available that can protect against some of the most common types of bacteria and viruses that can lead to pneumonia. It's especially important for high-risk individuals, such as infants, older adults, and people with weakened immune systems, to get vaccinated. Lastly, avoiding smoking and secondhand smoke can reduce the risk of pneumonia. Smoke damages the lungs' natural defenses against infections, making smokers more susceptible to respiratory illnesses like pneumonia. Prevention, as they say, is better than cure. So take the necessary steps to protect yourself and your loved ones from this potentially serious condition. Remember, your health is in your hands. Now let's tackle some common problems and questions related to pneumonia. First up, can pneumonia be cured completely? The answer is yes. Most types of pneumonia can be completely cured with proper medical treatment. However, it's crucial to follow your healthcare provider's advice and take the full course of medication. Another common question is, can I catch pneumonia from someone else? Pneumonia itself is not contagious, but the bacteria, viruses, and fungi that cause pneumonia can spread from person to person. Good hygiene practices can help prevent the spread of these germs. A prevalent problem many face is differentiating between pneumonia and the common cold. Both may present similar symptoms like coughing and fever, but pneumonia symptoms are typically more severe and last longer. If you're feeling unwell and symptoms persist, it's always best to seek medical advice. Some wonder, are there any natural remedies for pneumonia? While medical treatment is essential, certain non-medical treatments can complement your recovery. These include staying hydrated, maintaining a balanced diet, and getting plenty of rest. Lastly, is pneumonia preventable? To some extent, yes. Vaccinations, good hygiene, and a healthy lifestyle can reduce your risk. Remember, if you suspect you have pneumonia, don't hesitate to seek medical help. Early diagnosis and treatment are key to a successful recovery. Knowledge is power, especially when it comes to your health. Pneumonia is a serious condition, but with the right knowledge, it can be prevented, diagnosed, and treated effectively. We've covered everything from the basics to prevention strategies, non-medical treatments, and ways to address common concerns. Knowledge is power, especially when it comes to your health. It's been a pleasure guiding you through this journey of understanding. Thank you for joining me on Dr. Nguyen's YouTube channel. Stay informed, stay healthy, and remember, your health is in your hands.